Hey everyone, Dr. Josh Jagoda here. Today we are going to discuss ulnar nerve flossing, and this is really good for patients who are having numbness and tingling in the ulnar distribution of the hand. So the ulnar distribution of the hand may experience some weakness or some numbness and tingling into the pinky and the half of the ring finger. So those patients who are feeling kind of this type of symptom go down the arm, a lot of people will also say, hey, they feel like their funny bone got hit all the time. That's typically the ulnar nerve. So what we're going to do is learn how to nerve floss. And just to recap, nerve flossing is a technique that allows the nerve to glide and slide evenly past the structures within the arm and within the brachial plexus and the neck. So what we're going to be doing is we're going to be tensioning one side of the nerve while relaxing the other, and then tensioning the other side of the nerve while relaxing one. So we're going to create this back and forth type of motion for you, and this will help again that nerve glide and slide. So in this position, what we're going to want to do is first we want to lengthen the arm. The best way to lengthen the ulnar nerve is pretty much to do this type of position. This is kind of like a waiter's position. So if you've ever seen somebody carry a weight, like a wait staff carry a tray, it's kind of like this. So what you'll try to do is get your elbow about 90 degrees or even with the shoulder, give or take. And then what you're going to do is slight external rotation. So they kind of look a little bit like this. And again, the more you extend the wrist, the better off you will. In the office, if you can, what I would do is allow a little bit of extra over pressure to help really stretch that nerve. And it's a little different when you're doing it at home versus doing it in the office. But this is still something you can do on your own. So you'll take the arm, you'll put it in this lengthened position, and you'll extend the wrist. And sometimes you'll feel the numbness and tingling come on, or tension within the nerve come on if you're really experiencing these type of symptoms. So you really want to be careful. In this position, you will grab your neck and you will place it towards it. So in this position, what you'll be doing is you're putting some slack in the neck here, but tensioning the arm. And then what you're going to do is you're going to flex the forearm, or by flexing the wrist, but bend the neck away. So you'll be tensioning the neck here, but relaxing here, and then you're gonna kind of come in and out, over, and it kind of looks like this type of motion. So your finger at all times will point, if you think about it, towards the direction that you want to go. What you do not want to do is stretch the neck this way while stretching the nerve. And it's not to say that you can't get some benefit, but if you're really having exacerbations of these nerve-like symptoms, then what you would find is that sometimes it could be like tensioning the nerve at both ends, and that can really inflame you. So this is how to stretch or do nerve flossing within the ulnar distribution of the nerve, and this can really be helpful for those people who are having radiculitis, cubital tunnel syndrome, or any of those nerve related injuries that are affecting the ulnar distribution of that nerve. So that is how to do it, and we will follow with the median nerve next time, guys. Thanks again for stopping by. See you again. Bye. In the sun